management. Now, I'm in a Facebook group, and I'm not gonna mention the person's name, um, but I seen a picture of the gentleman's Driveline cord, and it was so tangled up, guys, that a regular LVAC coordinator could not help that at this point. I think we need the Terminator of LVADs. We need a coordinator T1000. That's what we need. You see what I did? The coordinator, Terminator, coordinator T1000. You're probably too young to get it. But, anyways, it was so tangled up, guys, that I became really concerned. And I do not want anything to happen to you guys. Anybody with an elf, I do not want anything bad to happen. Um, so I really want to stress how important driveline management is and taking care of your driveline cord. That cord can cause you so many issues. Can cause issues with the machine as a whole. It could cause issues with your health. Um, and it could cause an infection, a driveline infection. And now, if you guys haven't heard, if you're new in the LVAT and your team talked to you about driveline infections, let me be the one to tell you it's no joke. I have had a driveline infection, and that is what bumped me up to get me to the transplant list quicker. Now, any pull, tug, or tears at your cord, please contact your coordinator, get it checked out, just so they can make sure. Now, my driveline infection was, my experience was horrible. Drainage every single day, having to change my driveline, dressing every single day. It became quite stressful, and I had a son at the time, so of course I want to be active and playing with my son and things like that. And some points during the line, there was a small pool here, things like that. Now, I have heard where people get their driveline caught onto a doorknob. That sounds painful. So I really just want you guys to kind of please be aware, and please do not be afraid to contact your coordinator if you feel anything is off, or if your cords are really like tangled up. Like the gentleman's, no disrespect, the gentleman's LVAD cord was so like tangled up, guys. It looks like, when you have a kind of a bucket full of out extension cords and they all so tangled up together. That's kind of what his single drive line looks like. One drive line cord tangled up so bad that it looks like multiple cords tangled up so bad. Um, and I will put a picture right here, right now. So if you guys can see that, like I said, I'm not going to mention the gentleman's name, but I do get quite concerned when I see things like this, because I do not want anything to happen to any LVAD patient out there, and so now that you've seen his cord, I will kind of show you guys I did take some pictures of my driveline infection and the transitions of it from going from bad to worse. And so if you guys are like afraid of seeing a little blood or things like that, it's okay to turn this video off right now. But if you're not, then that's totally fine as well, and I'm just gonna put the pictures right here. So the first picture is this one. That was my normal drive line. That was a normal drive line, guys. It's just normal. Now, if you guys can see, that's a normal drive line. Now, fast forward some time forward, we get this. Now, this is what looks like a grape tomato. It's very red. It is very bloody. And it's very swollen for some reason. Now, fast forward, I go to the LVAD clinic, and they did this silver nitrate. I hope I'm saying it right. And they took it's like a Q-tip, and they kind of rub it around the driveline site to knock off that I call it extra meat. That's what I call it. That's what it looks like. But it burns off that extra part of the stuff that's around your driveline. So that is why it looks kind of gray, and you see like it has and I hope I don't ruin this for nobody, but I'm just gonna say it. It looks like a hickory smoked barbecue something. That's all I can say. Like, just looks bad. That looks very bad, guys. It looks very bad. So that is the reason that you should want to take care of your Driveline and make sure it's okay, it's not tangled up, it's not ripped, any wires aren't showing on the inside, and things like that. Now, if you look at this one, guys, this was me waiting. I had to wait in the hospital for a transplant at this point because my infection got into my blood and it went to my brain and caused me to have a seizure. Had to undergo a little small brain operation where they kind of coil you off the bleeding in the brain. And during that process, I had a mini stroke. And so I just want you guys, I just want to prevent any of these things from happening to you guys. So I kind of want to make this video, and that's why I'm making this video, to kind of give you guys kind of what can happen if you do not take care of it, or if you're not being careful with it and things like that. Now, last picture, guys. If you look at this one you can see some tissues, some meaty tissues hanging out of my driveline cord again, and it kind of burst through a new sore, as you can see right there. You see a little bit of the tissues right there. So you got tissues coming from two spots. And that was just a tough time being in a hospital waiting for a heart transplant and having to go through all those things. So again, guys, please, 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 please take care of your Driveline site, please, because it's very important. I do not want to see anything happen to any of you guys. I don't know you guys, but I love you guys, and you know, this is already tough as it is. You know, with you guys having the Lvad, or you're new to getting the Lvad, it's a lot to catch up to. It's a lot to take in. Even if you're used to it, you know, please take care of your Driveline. Please, 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 please.